More than 7,000 people have died of COVID at long-term care facilities in Ohio since the pandemic began. But where they died was a secret, that is, until now.
WCPO sued the Ohio Department of Health in August for the release of that public information. Investigative reporter Paula Christian tells us the outcome of that case and what it means to the public now.
The style and grace that Don showed was impressive.
Almost exactly a year ago, Joy Gazaway lost her 60-year-old brother, Donald Gazaway. His death certificate says he died of COVID. He died 3 weeks after going into a nursing home for a stroke.
I don't want another family to be in the position that we were.
The Ohio Department of Health's website only shows long-term care facilities, which includes nursing homes, with COVID cases. But it does not say how many residents have died there from COVID. Gazaway says that information would have guided her decision in how to choose a nursing home for her brother after his stroke.
I feel that it is public information, and it will help us to make better decisions.
Other states such as Michigan, Kentucky, Pennsylvania, Indiana, and West Virginia do release that information. But the Ohio Department of Health has argued that information is private under state law. WCPO filed a lawsuit against the Ohio Department of Health, arguing that it violated public records laws by keeping secret the number of COVID deaths at nursing homes. Last week, a special master in the case sided with WCPO.
The Ohio Department of Health ignored it. I mean, they just ignored that provision of the law, and they were called out for it.
WCPO attorney Jack Greiner called it a win for the media. The special master ruled that the Ohio Department of Health did violate public records laws, and he ordered Ohio officials to honor a request that WCPO made last June for COVID deaths at a specific Cincinnati nursing home.
That is really critically important information for the public to know. And it would have been nice to know on a rolling basis, on a current basis.
The ruling also made clear that the media must ask for COVID deaths numbers on a facility-by-facility basis and not by broad request, because that is how state health officials store the data. Despite the near year-long delay, Greiner says this information is still important to the public.
I think the public has a right to know which of the facilities did a better job or which of the facilities did a worse job.
A spokeswoman for the Ohio AARP agrees. In a statement to the I-Team, she writes, while the AARP has not engaged in the lawsuit itself, we continue to believe all efforts must be made to ensure that reliable data is publicly available. Joy Gazaway hopes this new information helps other families who may only have days to choose a nursing home if tragedy strikes.
If you were in the hospital and you and your family member had to select a nursing home or long-term care facility to continue your care, what would you select?
Based on our win in court, I will be asking the Ohio Department of Health in the coming weeks for the number of COVID deaths at each long-term care facility in our area, starting with Hamilton County. I will bring you that information when I get it. Paula Christian, WCPO 9 I-Team.
And as always, if you want to read more of Paula's specific stories over the past year on COVID in nursing homes, you can find them all, of course, on WCPO.com.